Well, I'm Chris Cannon here with Payal Kohli, one of our Timmy Fellows and a columnist in Cardiosaurus World News, to review through the hot topics that will be at ACC this coming week. For starters, we have the ACC booth. There'll be lots of presentations, and we'll be doing one on mobile resources.
Absolutely. That's going to be on Saturday at 1:45. And what I have in my hands here is actually the online mobile technology meeting planner. And this is available both on the iPad as well as the iPhone, as well as the BlackBerry and the Android. So it's a great tool for you to start organizing your schedule ahead of time and putting things on there. One of the few things you can put on there are some of the other ACC theater presentations at the booth, including the presentation on the Pinnacle Registry, as well as CardioSmart for your patients.
Excellent. And then we have the late-breaking clinical trials that headline all of the meeting, really. Beginning with on Saturday, there'll be one of the early ones. A colleague, Dave Morrow, will present the TRA2P presentation on a thrombin receptor antagonist, a novel antiplatelet agent. There's one trial at the AHA this past year, and we'll see this in over 26,000 patients as to what that plays out as whether one can add yet another antithrombotic agent.
Well, one of the exciting trials that we're going to see on Sunday actually is the results of the Seaport database, which tells us whether or not it's safe to have elective PCI in the setting of not having on-site cardiac surgery. So that'll be very interesting as well. And another trial on Sunday that's going to be very interesting is the Infuse Acute MI trial, which is a fascinating trial looking at intracoronary glycoprotein 2B3A inhibition plus or minus aspiration thrombectomy in the setting of primary PCI for anterior STEMI. So that'll be very interesting too.
Yeah, so in addition, the I2 Summit has lots of interventional trials, and here elective and STEMI PCI. Well, moving on to Monday, we have the ROMICAT-2 study. This uses the CT angiogram, much maligned, but has been seen to be useful in several studies. This is a multi-center study compared to the standard stress testing strategy to see whether this could be a more efficient way of ruling out MI and triaging patients through the emergency department. There'll also be a rapid rule-out strategy and one trial looking at rivaroxaban and treatment of pulmonary embolism.
Very interesting. And then finally on Monday, we're going to see, actually Tuesday, the results of PCSK9 inhibitor. Now PCSK9 is a novel target actually that's emerged in lipid therapy. It regulates the LDL receptor. And we're seeing that inhibiting this target actually is additive to statins. So this is the first of many trials I think that we're going to see with the results of PCSK9 inhibitors.
Right, and then rounding out the day Tuesday, there'll be a very interesting study looking at pacing as a potential treatment for recurrent syncope, a vexing problem that we all face. And finally, there'll be a study called Stampede. Colleague and Cardiosaurus leader Deepak Bhatt involved with this, looking at how bariatric surgery has effects on all the cardiovascular risk factors. So should we be stampeding our obese patients to bariatric surgery? We'll find out if we all stampede ourselves to the late-breaking clinical trials at ACC 12. We'll hope to see you there.
We'll see you there.